You look at what the President and Congress are right now proposing for all of us as Americans to have to live under for health care. What's your general response to that plan?
Well, I see them trying to take over 1/6 of our economy. That's the way I view it. I've had to work with the government in Medicare and Medicaid all the years I've been in the healthcare administration, but they're now talking about actually running 1/6 of the economy, and they can't even run the post office properly. You know, the president himself said, you know, the post office can't compete with UPS and FedExpress. He just said that yesterday on TV, and now they want to run the healthcare system in the United States, the best healthcare system in the world, and they've run nothing before. One of the committees, healthcare committees, discarded the pro-life position on the issue of abortion and passed the pro-choice position. So it is in the bill, and it may be, you have to look for the language, but it is in the bill. But no, the whole issue of abortion as it relates to the financing of Medicare and Medicaid and Social Security is a very curious issue. When you think about the fact that 30 to 50 million Americans have been aborted in the womb since 1973, those are all people that would be, or most would be, in the workforce today, earning money and paying Social Security taxes and supporting those who are retiring. I'm told that one out of every two people, is going to be supporting 2 people. Shortly, 1 is going to be supporting 3 retired people. That causes a great stress on the finances of healthcare and Medicare and Social Security. 1966, we were in the middle of the Vietnam War, and President Johnson decided we could have guns and butter. And they passed the Medicare and Medicaid Act. And they told hospitals and doctors, we will pay you whatever it costs you to take care of people's health care needs. And so we had Medicare and Medicaid. What happened from that is that hospitals were in a cost formula, so if they had a large percentage of Medicaid and Medicare patients and they were in the inner city or in a small town, they could still survive. One of the problems we have in small towns is a higher age group. A larger percentage of people in small towns are on Medicare or on Social Security, and so therefore they were fine as long as the government actually paid the cost of taking care of them. In 1983, Congress decided they couldn't afford that anymore, and in 1983 they passed a bill that they would pay hospitals on the basis of something called diagnostic related groups, DRGs. And essentially what that said, if you came into the hospital and had appendectomy, it would give you X number of dollars, and if that X number of dollars paid for 3 days stay in the hospital, that was great. If you had a complication, you had to be there for 5 days, the hospital would eat the money. If they could push you out in 2 days, they got to keep the money. And that's the way the system runs right now. Essentially, Medicare and Medicaid do not even pay the cost of taking care of people, and have not since 1983. And that's the problem. Particularly, it's a problem in small towns. Small town hospitals were closing by the hundreds across the country. Congress finally decided they had to do something about that about 10 years ago, and they passed a bill called critical access. And what that meant is if you were a hospital of 25 beds or less, and you had a high percentage of Medicare patients, they would pay you 101% of cost. Those critical access hospitals are in places like Edgerton and Stoughton and Boscobel and Columbus, many of the small towns throughout the country. And that critical access status saved the small hospitals in the small towns. The problem with the Obama bill is it doesn't address that issue at all. And so in cutting back on reimbursement to all hospitals, those small hospitals are likely to close.
So what we'd be essentially left with are these large group hospitals like the UW system or the DU. You know, one of the arguments that I've heard about this is that this will not impact the quality of care.
Oh my.
What do you think?
It has to impact the quality of care, because as the government starts to cut back on reimbursement for Medicare and Medicaid patients, and these, quote, 47 million people are going to add to it, the hospitals will have to cut back on replacing equipment, they're going to have to cut back on specialties, they're going to have to cut back on all kinds of things simply to survive. Even the larger hospitals are going to have to do that. So the quality of care is going to have to go down. Anybody who thinks that this doesn't mean rationing doesn't understand.
So it does. We're going to have
Absolutely.
to ration to
No
to
question
afford it.
about it.
Where do you see that ratio happening?
What's going to happen with old people? You really should call it a death squad, but it kind of perplexed me that we're putting something in that we're requiring people at 60 years old to have an end-of-life conference with a doctor, and then every 5 years, and every time their health care changes or they go into a nursing home. If this was just to make sure that everybody had a living will, or everybody had a healthcare power of attorney, that would be one issue. But the fact of the matter is that every person who comes into a hospital in this country today is confronted with the need to have a healthcare power of attorney. Hospitals don't want people there that if something happens they can't take care of their needs or know who to go to find out whether they should continue treatment or not. So every hospital I know has a social service worker. They have a state-provided form for healthcare power of attorney. That's been every state in this country. And you go into a hospital, they'll want you to sit down with a social service worker if you don't have a healthcare power of attorney. I've had one for many years. And so we have that already. The only excuse for doing what is being done right now in the House bill is to encourage people not to have treatment.
Wow.
And that's racial. That's the only thing it be. And it's perplexing to me that the Senate denied there was any language like that in their bill, and then 3 or 4 days later came back and said they took it out of the bill. Somebody isn't quite telling the truth. A company that has to make a profit versus somebody that doesn't have to make a profit. Obviously, the company that doesn't have to make a profit has a distinct economic advantage, and at some point they're going to drive the for-profit company out of business. That's what's going to happen. And of course, in the present bill, certainly don't ever change your job, because if you change your job, you then have to go to the public plan. And so I cannot see any reason why, if I'm running a company, I should continue to pay more for health care for my employees when they can get that health care for less with a public option. So as the President has said, it may take him 10 years or 15 years to get to a single-payer system, but that's what he really wants, and that's what our liberal people really want.
Under the Obama plan, and Obamacare as it's fondly referred to at this point, what happens to our pharmaceutical companies and our insurance companies?
Oh my. Well, let's talk about pharmacy first of all. The pharmaceutical companies are very profitable, but you got this problem. Once there's no profit motive to develop a new product, then new products don't get developed. I understand it costs $1 billion to bring one new drug to the market, and we are the experimental place for the entire world. We are doing all of the new drug development in this country, and the other countries in the world are benefiting from it. So there's that aspect. Then there's the aspect of where does that money go from the profits? That money goes into my IRAs and your 401ks and your state retirement plan and your teacher's retirement plan, just like the profits from the insurance companies do. You take away the insurance companies, how many hundreds of thousands of people are out of work? Are they all going to go to work for the government? And all of the profit from those companies is taken out of the investment pool, the IRAs and the 401ks and the retirement plans. So I see disaster happening.
It is worthwhile for citizens to let their elected officials know what they think about this Obamacare.
Absolutely. And that the community organizer, Mr. Obama, doesn't like the fact that people are organizing in communities, because that's what he did so well. And you know, I'm glad to see people turning out. I'm glad to see people speaking out about it. Frankly, we can't afford this. We can't afford this, and we simply will not own up to that.